Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kindly like, subscribe, and share for more. It's 3 a.m. The silence of the night is profound, a stark contrast to the turmoil brewing within. The world is silent, a peaceful hush enveloping everything outside. But your mind is racing, a relentless engine of thought. You've been tossing and turning, a nightly dance of frustration and longing. You are desperate for sleep that won't come, a sweet escape that remains just out of reach. Every sound feels louder, amplified by the stillness and your heightened awareness. Every minute drags on, each tick of the clock a painful reminder of the precious sleep slipping away. Tomorrow looms, a big day, filled with responsibilities and expectations. And you know you need rest, that vital recharge that will allow you to face the day ahead with energy and clarity. This is insomnia, that unwelcome companion that steals your nights and shadows your days. A struggle millions face, a silent epidemic of sleeplessness that affects people from all walks of life. Lack of sleep isn't just tiring, it's more than just feeling a bit weary. It affects your mood, focus, and health, impacting everything from your relationships to your productivity. The stress of not sleeping makes it even harder to drift off, anxiety feeding the very problem it seeks to solve, creating a vicious cycle, a self-perpetuating loop of sleeplessness and worry. Lying awake while the world sleeps can feel isolating, a lonely vigil in the quiet hours. In these moments, the idea of a sleeping pill is tempting, a beacon of hope in the darkness. A quick fix for exhaustion, a promise of immediate relief from the torment of sleeplessness. But sleeping pills are powerful drugs, with potential side effects and long-term consequences. Not a simple solution, but a complex intervention that requires careful consideration. Before reaching for medication, pause and reflect on the bigger picture. It's crucial to understand your sleep problem, to delve into the underlying causes of your insomnia. For many, better sleep starts with finding the root cause, addressing the habits and patterns that contribute to sleeplessness. Not the pharmacy, but within yourself, by understanding your body and mind. Sometimes, under a doctor's care, medication can help, a tool to be used judiciously and with guidance. But it's not the first step. It's a consideration after exploring other avenues for better sleep. Sleeping pills, sedative hypnotics, are prescription drugs that help you fall or stay asleep by slowing brain activity. They're meant for short-term use, breaking cycles of insomnia when other methods fail. Doctors usually explore your sleep habits and may suggest behavioral therapies like CBTI before prescribing medication. Pills are a temporary bridge, not a cure. They treat the symptom, not the cause. Different pills target trouble falling asleep or staying asleep. They're part of a broader plan, giving you rest while you work on long-term solutions. The goal: restore natural, healthy sleep patterns. How do sleeping pills work? It's a question many of us ponder as we reach for that little pill, hoping for a peaceful night's sleep. But what's really going on inside our heads when we take a sleep aid? It starts with your brain's chemistry, a complex and delicate balance of various compounds. Think of it as a symphony of signals constantly being sent and received. Neurotransmitters like GABA calm the brain, acting as a natural tranquilizer. They help to slow down neural activity, reducing anxiety and promoting relaxation, while others, like adrenaline and dopamine, keep you alert and focused. These stimulating neurotransmitters are essential for daytime function, but can be disruptive at night. Most prescription sleeping pills boost GABA's effect, amplifying its calming properties. They essentially give your brain an extra dose of the relaxation it needs, slowing brain activity and easing you into sleep. This allows you to drift off more easily and stay asleep longer. Some newer drugs block orexin, a chemical that keeps you awake. Orexin is like the brain's internal alarm clock, signaling alertness and preventing sleep, like cutting the brain's go signal. By blocking orexin, these medications effectively turn off the wakefulness switch. Over-the-counter sleep aids often use antihistamines, typically used for allergies, which cause drowsiness by blocking wakefulness signals. This is why you might feel sleepy after taking an allergy pill. These are not for long-term use, as your body can develop a tolerance, reducing their effectiveness over time, and can cause grogginess, especially in older adults, who may metabolize medications more slowly. Each drug works differently, targeting different neurotransmitter systems and pathways in the brain, which is why side effects and effectiveness vary from person to person. What works wonders for one individual might have little to no effect on another. Understanding these mechanisms, even at a basic level, helps explain why your doctor chooses one medication over another, considering your unique needs and circumstances. The right choice depends on your specific sleep issue and health profile, including any other medications you're taking and any underlying health conditions. But remember, all these drugs are tools. They're designed to help you manage your sleep, not to cure any underlying issues. Not solutions for better sleep. Addressing the root causes of your sleep problems is crucial for long-term success. They should be used carefully, under the guidance of a healthcare professional, and only as part of a bigger plan, incorporating healthy sleep habits and addressing any underlying medical or psychological issues. Never self-medicate, as this can be dangerous and may mask underlying health problems, or mix with other substances, especially alcohol or other sedatives, as this can have unpredictable and potentially harmful effects. Always consult your doctor for guidance on the best approach to managing your sleep and ensuring your safety. Dosage matters. Doctors start with the lowest effective dose to reduce risks. The type and timing of medication depend on whether you struggle to fall asleep or stay asleep. Short-acting drugs help you drift off. Longer-acting ones keep you asleep. Sleeping pills are for short-term use only. Long-term use risks dependence and tolerance. Never exceed your prescribed dose or mix with alcohol or other drugs. Always follow your doctor's instructions and report any side effects promptly. Safety always comes first. Remember, sleeping pills aren't a one-size-fits-all solution. They're not for everyone. Individuals with pre-existing breathing problems, such as asthma or COPD, those with liver or kidney issues that might affect medication processing, or anyone with a past history of substance abuse or addiction, should generally avoid them due to the risk of dependency. Pregnant women and older adults often face higher risks and potential complications, and therefore need to exercise extra caution and consult with a healthcare professional before use. Common side effects that you might experience include next-day drowsiness, which can impair your ability to focus, dizziness, potentially leading to falls, and in rare cases, sometimes dangerous and complex behaviors like sleepwalking or even sleep driving. If you experience any unusual or bothersome side effects, or if you have concerns, immediately stop taking the medication and promptly call your doctor for advice. Before even considering pills as an option, prioritize improving your sleep hygiene. Try to keep a regular sleep schedule and routine, even on weekends. Make sure your bedroom environment is restful, dark, quiet, and cool, and diligently avoid caffeine and alcohol, especially close to bedtime. If these lifestyle changes don't provide sufficient relief, see a doctor for a personalized treatment plan tailored to your specific needs. If medication is deemed necessary, use it only as a short-term tool to address acute sleep issues, and always under the guidance and supervision of a qualified medical professional. Maintain open and close communication with your healthcare provider throughout the treatment process. The ultimate goal, of course, is to facilitate a safe and sustainable return to natural, restful, and healthy sleep patterns without relying on medication. UMCC, your ultimate medical consultant connector.